Hedi, Sibuzi, Nicole Cardinal Hesley, C. Stella Satahanya, Snachalya, Musqueam, Squamish, Tsleil-Waututh, Indi Yankit Jan Sesyen, Masi. Hello, my name is Nicole Cardinal. I am the Aboriginal Health Strategic Lead for the Office of Indigenous Women and Children. And I would like to introduce Elder Delhia to open our webinar to start in a good way. Thank you.
Awesome. I would like to welcome you, each and every one of you, to the traditional territory of the Coast Salish people, the Musqueam, the Squamish, the Tsleil-Waututh. Just want to ask the ancestors to step aside and let the living do their work. We just pray for the safety of everyone on this webinar. We pray for the learning that will be happening today, the learning on both ways. You know, Chin Chin Swai, we work together. We are in the same canoe. We are working towards the same goal. So Chin Chin Swai is when you work together and each one of us lifts the canoe. When you know who you are and you know what to ask for, and you listen to the people who know who they are and they know what to ask for, and you work together, it lifts the canoe, and it's called Chin Chin Swai. It lifts the canoe and it helps us to get to our place of where we need to go, and further gives us strength to move on. OCM. Thank you.
OCM, thank you so much, Elder Delhia, for starting us off in such a beautiful way and helping us get grounded for our session today. Aswayal, hello everyone. My name is Miranda Kelly. My ancestral name is Cheyenne. I'm Stalo from Somali First Nation with ties to Cowichan, Sumas, and Snemo First Nations on my dad's side and mixed settler ancestry on my mom's side. I'm the Director of Indigenous Women and Family Health here with at Vancouver Coastal Health Aboriginal Health Team. It's my honor, along with Nicole, to be hosting this session today on social work interventions with Indigenous families. We are going to be hosting this as a very informal roundtable chat with our four amazing panelists here today, Elder Delhia, Cheyenne, Jeanne, and Olivia. And rather than reading out their bios, I actually wanted to just start off our session with giving the chance for each of the panelists to introduce themselves. So we can go around in a circle, and please introduce yourself and take your time to speak to what has called you to this work that you do to support Indigenous families. So why don't we start with Elder Delhia, and then we'll go around the circle to Cheyenne, Jeanne, and then Olivia, please. Thanks.
OCM, my ancestral name is Dalgam Ha. It means speaking to the air. I am from the Nisga'a Nation, and I'm from the Eagle Clan, the House of La. And I've got a BSW and a BA in psychology. And I've worked for 12 years as a social worker, and then another 8 years working in the downtown east side with harm reduction and working with families who are dealing with homelessness and harm reduction and helping mothers keep their children safe. So that's always been my goal, is to keep mom and her children together in a safe manner. And also when I work, my motto is always let her be the hero of her story. So, you know, I work alongside. I don't work above, I don't work below. I work alongside our clients, and I try to listen more than I talk. Awesome.
Good morning, everyone. My name's Cheyenne. I am Cree from the Kawakatus First Nation, and I'm also French as well. Yeah, I'm a social worker. I guess I graduated in 2016. I feel like I always laugh about this because I feel like being a social worker was the last thing that I actually ever wanted to be. Yeah, and I just kind of fell into this profession. Initially, I wanted to study like Indigenous law, and I found myself volunteering a lot on the downtown east side, and really realizing how passionate I am at supporting families, and then also like this work is very personal as it is for most of us. I have a lot of relatives who are still healing from their trauma, and they're still struggling with addiction and all the pain that they've been going through. And so yeah, so I think that's kind of what pulled me to this work, and I've had many challenges kind of figuring out my footing in this profession, but I do feel like I was called to this work for a reason, and yeah, that's kind of me. Thanks.
Good morning, everyone. My name is Jeanne, and I am from Fort Nelson First Nation on my mother's side, and Danae, and on my father's side of settler ancestry and of German ancestry. So currently I hold the role for the Indigenous Healing and Wellness Lead for the Provincial Perinatal Substance Use Project, which is housed here at BC Women's Hospital. Prior to my role on the Provincial Perinatal Substance Use Project, I have been a social worker at BC Women's Hospital and Children's Hospital. So I've worked in a few units here at Women's Hospital, Oak Tree Clinic, First Square, where First Square really led me to my work on the Provincial Perinatal Substance Use Project, working with people who are using substances during their pregnancy. So that's really a lot of my focus of my work. But I've also worked through Indigenous health here at BC Women's and Children's Hospital as an Indigenous patient liaison, and actually worked with Cheyenne and also went to school with Cheyenne at UBC when we were both doing our social work education. And so I think for me, being a social worker, there's many layers to that. I can just echo also with Cheyenne. I didn't really find myself either wanting to be a social worker. I think it was the last thing I thought of as a career choice, and in this profession. And there's many reasons to that. Just given my own experience with the social work profession as someone who was placed in the child welfare system, and just really seeing the impacts of the residential school system, as I'm an intergenerational residential school survivor. And just, it's been something that I feel that I didn't want to be a social worker. However, I found it was a place that I could do a lot of work that I felt I was really connected to. And I never thought I would also be in healthcare working as a social worker. So that's just, it's always so interesting the way we find our paths and journeys to what leads us to what we're doing. And, and when I think about social work and becoming a social worker and what led me to it, there's definitely, I think for a lot of us, is just that personal experience, but also that real deep call to look and really further social justice. And what does that actually look like? We really looking at systems work and advocacy, and how we can really ensure, and as Indigenous peoples and as an Indigenous social worker, that's something that I feel that I'm really trying to do in my work. And so it's been an exciting beginning of my career. I still feel like there's so much to learn and so much to gain, and I just feel so honored and privileged to do my work, working with families and patients, and doing the work specifically in the perinatal substance use field. So I feel so honored, just also recognizing that as much as I've had my social work education and went to school, that so much of my education and what brought me to social work is very much influenced by my relationships, my ancestors, my family, elders, Elder Roberta Price and Elder Glida, Elder Delhia, just so many beautiful elders and elder medicine that have really supported me in this work. So I really always want to honor my elders and my ancestors for really, I don't do this work alone. And I know Elder Roberta says that a lot too. And so I just really raise my hands to the elders for really holding me up in a good way to keep this work going. So Masi, and I'll pass it over to Olivia.
Hello, my name is Olivia Louie. My ancestral names are Hope Hope and Mikanakakwe. I am from Slalom First Nation on my dad's side and Key Nation on my mom's. So pretty much related to almost everybody. I am a full spectrum Indigenous birth worker and a member of a Cradle Collective. I also provide enhanced maternity care through Kalala Lalem and offer some new parent groups through Heron's Nest, through the Vancouver School Board. I am so honored to be a birth worker. It definitely took me a long time to find this calling, but it's just feels so right. And I'm so fortunate to be able to work with the families that I do and provide care and support and love to them. And I'm very grateful to be here in this circle with everyone today and with everyone watching and joining us.
Thank you so much to all of you for those introductions and for us to get to know you a little bit better as we start off this conversation. And what stood out to me is a number of you spoke about how personal this work is, and that's something that Nicole and I talk a lot about within the Aboriginal Health team here with our VP Leslie Bonshores, how so many of us feel that really deeply personal connection to the work that we do and that it impacts us and our families and our villages and our network. And right before we started this webinar, we were all kind of laughing about the personal connections that we have to one another, and that it's really true what you say, that we don't do this work in isolation. We really do work within this network of elders and sisters and aunties and birth workers and social workers, and we all hold so many roles within our families and our communities, and there's such strength and power in us as Indigenous women being able to sit in circles like this and uplift one another. So thank you again so much for joining us. And maybe what we can do now is go around the circle and talk about what are some of the key issues or impacts of social work intervention with Indigenous families during the perinatal period. So during pregnancy, childbirth, and those early postpartum days. From your perspective, what do you notice as some of the key issues or impacts? And why don't we go again to Elder Delhia to start us off?
OCM. Within the Squamish Nation, we have something called a welcoming ceremony. We lay down the blankets. And we have mom and we have baby, and they carry. The mom carries the baby, and all the supports are there. All the supports are there. Whoever is going to support this child, they're there to, to welcome the baby to the community. Of course, with COVID, it's probably hasn't happened for a couple of years now, but it's usually about this time of the year when we start our feasting system. We start our feasting system in Squamish Nation that, that's always one of the very first feasts, that happen, the welcoming ceremony of every child that has come, and they're wrapped in a blanket and they're introduced to the community, because it takes a community to raise a child. It takes a community to bring this child up. And I know there's a lot of other organizations that have adopted this, and which is very beautiful. But wrapping of the blanket is one of the first things that happen for a child, or one of the first ceremonies that happen for a child. And also the, with Nishka, was talking earlier about something we call cradle. and it's a wooden cradle that hangs from the ceiling. And the child is put in this in the cradle, and it also makes it easy for mom to say, like, can you watch the baby for a while, because then the babysitter, all they have to do is push. So, and it keeps the child safe from other children, and keeps the child safe from the dogs and animals and the cats and whatever. Or if you're really, really busy, you just have to put the baby in the cradle and give the cradle a little push. So there's a few interventions as Aboriginal people we have with for babies and stuff like that, and all the way through pregnancy. Like my daughter's pregnant now, and it's all coming back to me. And the thing is never to keep still, never to stay still. Keep moving. It doesn't mean you have to jog, like every day, but you must move. There, like a lot of times, the child, the mother will be feeling like very lethargic. And so there's always an auntie that comes over, catches them on the, like, okay, time to move, get up, we got to move. And it's always they're always afraid that if the baby lays too much on their stomachs, or lays too much, their skin is up against the womb, that they will have skin problems. And there's all kinds of there's no proof for it. Like my daughter canoed, when my grandson had eczema. So I don't think there's any proof to it. But they still will not let the mother rest. So my doctor has said, or her doctor has said, don't listen to your mom, you have to rest. But because she has a heart palpitations. Yeah. So anyway, those are a few interventions. I'm sorry. I hope I answered that question.
Yeah, so it's a key issues that impacts the social work intervention with Indigenous families on their perinatal journey.
Oh yeah.
We can come back.
Okay, we can come back to me. Yeah.
I think it's going to me. Yeah, I thank you for sharing all those, Elder Delhia. I feel like those are like the teachings and the practices that are so important to Indigenous families. And I feel like for me in healthcare, that's kind of the challenge, is that that's missing and there's no space for that. I think even as like social workers, we're often negotiating like, whether or not our role is important in healthcare, because we're often like healthcare is focused on physical health, and we don't consider like social determinants of health and all those things. Like that holistic health is so important to us. And then also, bringing that even further as Indigenous social workers and working with Indigenous families, our practice is very focused on Western theories, and it's like really just really focused on these perspectives that like we just don't have space for sometimes in our practice. Even where I'm working at right now, I'm working in community, and I find I have more space to kind of offer these supports to families, and like bring in elders, or like, really focus on community and like work with families. I still feel like I'm really limited in my time and how much like resources I can dedicate to families. And because I have to kind of work with everyone on like in an equal kind of way, even though some of my families might need more support in some ways. And even if, even though I'm working in like a more one-on-one approach, like I feel like bringing in someone's family and really including them in my interventions is so important. I don't know. That's kind of what I was thinking. I don't know if you want to jump in, Jeanne, or I'll pass it on to you.
Yeah, thanks, Cheyenne and Elder Delhia. And um, I really connect with Cheyenne and what she is sharing just regarding the being an Indigenous social worker and also working within a healthcare setting, and just that feeling of walking in two worlds of like the Western way of being and knowing, given this is it's from a medical perspective, and then also holding in tandem the as an Indigenous person and as an Indigenous social worker, holding the way our ways of knowing and our ways of being and practicing, and that tension that just exists within our practice. So I know for me, and I appreciate that tension. However, how do we really work to bring in interventions that are really culturally safe and do that in a good way? And I think that's the tension that um, I navigate a lot. And I know, Elder Delhia, when you're sharing about, I'm just thinking of like interventions with families and just how important and we look at culture and that and ceremony, and that is an intervention. That is when we look at healing and wellness, people come to healthcare and because there's healing that needs to happen. And when I think of the work I do in perinatal substance use, we're not talking about substance use. We're really talking about the impacts of colonization. And I see that's such an important piece, is that really laying the foundation that in this work, whether it be social work or in healthcare or in community care, acute care, community care, that it's such an important piece to lay that foundation of just the work that starts with us as the providers and as the practitioners and the clinicians, that we really lay the foundation to be reflective in our practice and really understand how we come to this work in a good way when we're working with Indigenous families. Because for me, it's not if trauma is there or in the room, it's when it's not if, it's when it comes in the room. And I think that's such an important piece that I try to reflect on. And also, if I'm starting with myself and the power that I hold in my role as a social worker when working with Indigenous families, that's such an important piece to reflect on, and to really keep on reflecting that it's an ongoing process and learning journey for us as the practitioners, social workers, whatever role we hold, that we have power and how we can use that power in a good way. And if we misuse power and harm does happen, how we repair that and what does that look like in our practice. And I find that such a key intervention is to start with ourselves and unpacking that. And I think also going into, as a healthcare, working in healthcare, that, being on an interdisciplinary team, that we all wear a badge and that shows power too as well. And so whenever we walk in a room, I just really try to encourage my team or just colleagues that it's so important to recognize when we walk in the room how we hold that space with families, because that's an intervention. Like when we're talking about what does safety look like, what does Indigenous cultural safety look like, because Indigenous cultural safety is that Indigenous peoples get to say when care is safe and when it is not safe. So that's everything for me, even as an Indigenous social worker, that how do I work towards a place of safety? Because being in a healthcare setting, it can be really difficult. It can be hard. And given the history of healthcare and also given the history of the social work profession, that's such an important piece to reflect on. And whatever professional role you played, acknowledging and unpacking how that role has impacted and still impacts Indigenous people's lives. And so for me as a social worker, that's really recognizing, it was social workers who took our families to residential schools. Like the social workers were agents of settler colonialism and implementing these policies that we see and are very much a part of Indigenous people's lives today. When we look at social determinants of health and all those pieces. So I think that's another really important piece as well, is really unpacking from not just a historical perspective, current and ongoing impacts that your role has played when it comes to supporting Indigenous families, because that's such an important piece, I believe, really just that foundational piece of reflection and education of learning, those pieces. So, and I think just going back to one more thing, as a social worker myself, just the importance of what safety looks like and whatever role you play. And I know Elder Delhia said this, that, her motto is that the woman is really the hero of her story. And I think that's such an important teaching, and that really, what does it mean to come from a place in your role to ensure that, the families, Indigenous people, Indigenous women, especially from the perinatal perspective, are the experts in their lives, and they know what they need. And so what does it mean for me as a social worker to really witness and just be in relationship, and in good relationship, because so much of our work is about building relationship. And that's not just for us as social workers, that's for us as doctors, as nurses, as in community, that we're really here to witness in a good way. And I always think when we go to ceremony, there's always roles that we're asked to be a part of in people's ceremony. We could be a helper, we could be a witness, we could be playing an active role in somebody's ceremony. And I think when we look at the perinatal period for people, that this is ceremony for them, and what does it mean to come to this time in their life in a good way, and what role are you being asked to take part of, and how you are really accountable to that role, and holding it in a respectful, non-judgmental way, always centering that Indigenous peoples are the expert in their lives, and they know what they need, and we're really there to walk alongside and witness and be a good witness. So so that's what I'll share with that, and then I will pass it on to Olivia.
Thank you. I think, kind of echoing Cheyenne and Jeanne, the idea of walking into worlds really resonates with me. And as a birth worker supporting families through their perinatal journeys, I think my role as a helper is to kind of hold that space for their emotional and spiritual journey as they're coming into parenthood, especially when there is social work intervention that is happening through the perinatal journey. Really being able to hold the space for them to come into their role as a parent the way that they see fit, the way that their children need them. That's what's really important to me. And I do feel also just like so privileged and honored to be able to hold that space specifically for them, and not have to worry so much about like the healthcare aspect, and work within a system like the system that I work within as community and relations and family. Yeah, I think I will think some more on this as well and join the conversation again in a bit.
Yeah, thank you so much. So much of what all of you are saying is just really resonating with me, and thinking back to what brought me to this work. My own personal journey of becoming a parent really influenced my move into work that really supports Indigenous women and families, especially in this perinatal period. And prior to coming to BCH, I was working as a doula and a childbirth educator, working with Indigenous families in the Vancouver area. And part of what really drove me to want to explore how to better support Indigenous families during that perinatal period was my own experience of becoming a mom after giving birth to my oldest daughter. I had undiagnosed postpartum depression, and I really, really struggled with that. And it took me a long time to kind of find my footing as a parent, and to feel comfortable and confident calling myself a mother and owning that role for myself. And following the birth of my second daughter, things just went much more smoothly. I kind of had better idea of who I was as a mom and what to expect from a newborn baby. And one of the things that made a difference for me is I hired an Indigenous doula as my postpartum doula, and she came and supported me in those very early days with my brand new baby. And everything just went so smoother the second time around, and I thought, gosh, like, why was it so much harder the first time and the second time? And knowing that if you have the right supports in place, it really can make such a huge difference during that transition of welcoming baby into the home. And I felt sadness for my past self and what I didn't know and the support that I didn't have, and I just didn't know how to find that support the first time around. But when my second daughter was about, I think, 8 or 9 months old, my community of Sawali had a baby welcoming ceremony, similar to what Elder Delhia was describing. And this is a practice that is being reclaimed. And so it was only the second time that my community was having this sort of ceremony. And so my oldest daughter had never had the chance to participate in something like that. But with this baby welcoming, when I brought my second daughter along, the folks organizing the ceremony said, oh, well, your first daughter never got to have a welcoming, so she can join in. And so during that ceremony, both of my daughters were welcomed into the community, and I felt that sense of love and kinship and support from my village, which I think is actually the intervention that I really needed the first time around, when I was really struggling with postpartum depression. But that said, I think it's never too late for that kind of positive cultural intervention. And it really did help me to heal from that experience. And it was shortly after that that I ended up connecting with my first doula client and pursuing birth work, because I finally found a place where I was doing well enough to be able to now care for others and pass that support on. So I just want to thank you for all of you for the incredible work you do, and for really highlighting the importance of ceremony and recognizing this perinatal period as ceremony, and the way that we can support families through ceremony and through culture. So with that, I'd like to pass it back to Elder Delhia and Nicole to see if you have anything to add.
Okay, which one is that one?
So what are some of the key issues, impacts of social work intervention with Indigenous families on their perinatal journey that you've encountered in your work?
Okay, so keeping to who I am as an Aboriginal person and my teachings has been very difficult as a social worker. For example, when I work with someone, I remember sitting at the table. In the Nisga'a Nation, we have what is called the Bulsuwit, and these are your father's sisters and their family. They are the people that counsel you and take care of you. And so that was where my training started as a social worker. It was started there with my aunts. And so whenever I work with someone, I say, I am their auntie. I am here. This, so it changes your perspective from an industrial social worker to like, I am their auntie, or if I'm working with a grandmother, I work as a sister, so I look back at my aunts who were incredible, incredible. I was very lucky to have Will Sewit, who would sit and counsel me. And this is our way, this is our law, this is our duty. And duty is such a strong pull for us to stick within our laws. I'll give you an example. Over the weekend, my family had a feast, and it is our duty to contribute to the feast. So for this feast, they raised $65,000. And it's all volunteer, it's all duty driven. And it's so important that we look at our laws, our laws, and introduce our laws, talk about our laws. The laws of Canada were written by some guys back in Charlottetown. Why should they affect us? At the time when they were doing Confederation, you know, like John A. MacDonald and all those, you know, men sat around the table and, you know, said, well, who's gonna be in charge of these Indigenous people? More, you know, that, you know, they didn't say it as nice as I do. You know, they said, you know, what are we going to do about the Indigenous problem, and whose jurisdiction is it going to be? And it ended up being, the federal. We became a federal responsibility, and you know, so which was really strange. You know, when you go into social work on reserve, because you know, as you know, provincial guidelines are the Community Child and Family Services Act is a provincial jurisdiction. You know, so they would give, so they would lay down the law. So the way we said it was the federal government, but the federal government gave us the money for it because we are federal government responsibility. So the money would come from Canada, but the laws would come from BC. So we would say, you know, the federal government gives us the purse, but the British Columbia held the purse strings, so we had to follow. So it was a really strange. I'm sure it still is. It's been quite a few years since I've worked in it. I just gave up. It was just ridiculous. It was a strange situation where we had to develop our own interventions. Otherwise, people on reserve did not receive interventions, and so we were everything, within the funding. And the poor meager funding that they did give us. And I remember one young mother, she was working with her alcohol addictions and depression and health matters and stuff like that. And so I sat with her and I said, well, what do you want to do? And I said, what do you want to do? I know there's concerns with MCFD and stuff like that, and I'm here to navigate you through it and to help you through it. And she goes, well, I want to join the canoe family. And I went, wow, that is perfect. I said, that's excellent. The canoe family, each, like the Squamish Nation has a canoe family who are very strict, so they're this drug and alcohol free. You have to do physical exercise. You have to be part of the family. You're pulled into a family and you're cared for and you're loved, but also you have the duty. This is what's missing with a lot of a lot of things, is because we should be duty driven, not monetary driven. So anyway, so I wrote up the case plan, and I thought, oh, this is the best. I was so proud of myself. I said, this is the best, right? And so I brought it to MCFD. So this is our plan, laid it out. She's going to join the canoe club. This is blah, blah, blah. And the social worker said, no. I'm like, excuse me? And she said, no. And she handed me a telephone book full of resources. She says, pick one of those, or otherwise we're going to take the kids away. I'm like, I was so hurt. I was, that was the writing on the wall, because, it just really irked me that, these programs, they were receiving tons of provincial money, and tons of provincial money, and they could be fancy, and here was the Squamish Nation, canoe group saying, we want to help this girl. They didn't ask for any money, and they were poo-pooed, and you know, and of course, you know, like I said, you know, don't, you know, go to, you know, find a program, you know, like they'll just tick you off, you know, like, you know, but don't, you know, do what you want to do, you know, be your own solution. Join the canoe club, and she did, and she's been sober ever since, and working really hard for them, and they work really hard for her, and you know, so you know, it, you know, like it all, like I said, it all started back then when somebody somewhere decided that we were a problem, and that the federal government is responsible for us, you know, and then of course the provincial government says, well, they have to follow our rules, you know, and you know, so it's I'm not sure how it is with healthcare. So I left, you know, the social work and, you know, stuff like that, because it just felt like, to me, I was just writing a diary on people and not really doing much. So I went to Wayne City Housing, and we worked on something called the Budsy. It was just, and I just love this project. So we, you know, so we have people who, they must, you know, like, we work with mothers. They must have, you know, at least homelessness, some kind of barrier. They must have drug and alcohol barriers, or, you know, every kind of barrier. The more barriers you have, the more you qualify for the housing. We have 24-hour support, and we have cameras on every you know, every angle of the building. It's very secure, and we have, you know, like, anyone that comes into the building must show their ID. You know, we must know who is in the building at all times. But other than that, we let her be the hero of her story. You know, we don't, you know, other than this, the total security of the building and the child, you know, we let her be the hero of her story. And we provide safety plans. You know, like, yeah, there, you know, mom's got to go out once in a while and stuff like that. But we have to build a safety plan around the child. Like, if the mother feels like, okay, this is the weekend we're going to drink, let's do it in a safe way. Let's do it in a way that, you know, doesn't, you know, have people calling, you know, MCMD on you, or Thank You for Coastal Health, and just do it in a very safe way. And so I think the Budsy is one of the, you know, and we're building another one in North Vancouver. Yeah, so so we, you know, that is just, you know, there, you know, there, it, you know, like, it's, we need more Aboriginal content, and most, you know, and I'm always there pushing the Aboriginal content and Aboriginal interventions and stuff like that, and you know, and that's, you know, there's still a lot to do, but we have kept 50 children safe for over 4 years, and I think with their mother, you know, and so I think we need to build more Budsies, and really work hard and find amazing ways of how to help mom, right? You know, it's all about keeping the mom safe. It's, you know, like, we have a little, you know, such history of, you know, every one of them, in the history of trauma, trauma and sexual abuse, and you know, drugs and alcohol, you know, and the deep love for your child, you know, is something, you know, the deep love, you know, and no one else is going to love that child more than the mom. You know, no one. And you know, you can put them in a safer place, you can put them in a safer home through foster care, but they don't love the child the way mom, you know, the mom, and you know, and when I worked as a social worker, every child, you know, no matter what kind of situation they were, you know, they worry about their mom. They worry about their mom, you know, and how's my mom doing? I haven't seen her, you know, and, you know, so like half my job was chasing mom and like, you know, trying to get her, you know, like, you know, to visit with the child and, you know, and stuff like that. And, you know, because the child really needs that mama's love. God puts the child with a woman. God puts child with a woman, you know, and you know, who are we as people to break that? Who are we as people to break that? You know, and just I know that, you know, building more and more supports in to replace family that naturally would come in, you know, like, you know, if I was neglecting my child or something like that, my aunties would swoop in, right? You know, like, oh, okay, Delia. You know, there's a, you know, so we need to, you know, we need to start thinking about, you know, how to support mom. How are we going to support her? Now, OCM, I think I'm taking up too much time here.
What? I just have a comment while you were all speaking and hearing Elder Delhia talking about the aunties and the matriarchs. It reminds me of the Aunties Council. The Aunties Council and the guidance, and my mom, who is, she calls herself an advocate with no name. She has no name in the potlatch, but she's real bossy. So she says she's an unsolicited lawyer. My mom has been a child advocate my whole life, and this is probably where I get my spunk from. Because now I'm going to be Auntie Nikki, and I'm going to say, I'm going to act like my mom. My mom's name is Doris, and they call her Tot, which means grandma. And they're like, oh, here comes Tot. My mom would walk into all these big ministry meetings, and she lived in Vancouver when they were having conferences, and she just walk in and wasn't on the list, and she just took the mic and would say all these things. And she said, our people always had a child welfare system. Right? Mic drop. That's it. We have things in place. We have culture in place, and you talk about that, Elder Delhia. You all talked about it today, and the welcoming ceremony. And so I'm just really grateful to hear that, because that needs to be said in this field of healthcare when we're dealing with perinatal, you know, birthers, Indigenous birthers on their perinatal journey who use substances. And so just to share it with our audience, to keep that in mind. Indigenous folks have always had child welfare systems in place, and now we just need to elevate those systems back up so we can all access that care, and kind of going back to, it takes a whole entire village to raise a child, because it does. So I just wanted to close off that question with those comments. So Snachalia, thank you for sharing those teachings with me and reminding me the gift of the Aunties Council. You know, you have your own council. They might not be aunties, but you all have a council you all go to. So those are your people too. You can look for support.
Thank you so much, Nicole, for that mic drop. Love that. If you don't mind, I just want to share some of the comments and questions coming into the chat. One of the comments is, prevention is so huge for our people. Working with the family and keeping children connected to their family is very integral to the survival of our children, our race, and our community. Yes, thank you for that comment. One of the questions, and maybe I can pass this to Cheyenne and Jeanne to start, is what are some of the collective actions that you would like to see from social work as a profession to support decolonization?
I can go first. Me and Cheyenne were like, you go first. No, you go first. That's a really good question. And I think when it comes to collective action that the profession of social work can take is, you know, I think of just my experience through just education. And when we go to schools to become social workers, that is a first place of contact and intervention when it comes to really educating from a place of, you know, on the syllabus, how many Indigenous authors or BIPOC authors are on your syllabus as a professor. I think, you know, when we look at that piece of like just that maybe like academic bubble of like decolonization when it comes to our education as social workers, and our training. I think another place of decolonization, and I know for me specifically, when it comes to working in the perinatal substance use field, you know, I feel very honored and privileged to get to do my work from a provincial lens on the project. And I think that there's so much movement within acute care and community care to want to really look at what does it mean to decolonize their practices. And I know I said this a bit earlier, but just really looking at it, what does it mean to decolonize substance use, and what does that look like in the system, and really unpacking that also in how stigma is so much a part of this work when it comes to substance use in pregnancy. And so I think there's so much in just that perspective of just really looking at the impacts of colonization. And when we look at the impacts of colonization, we go up to, you know, really looking at it through the lens of how residential schools, 60 scoop, land theft, ongoing child welfare experiences for Indigenous peoples really impact that feeling of loss of hope and fear and lack of safety. And from there we find, well, how do we cope with those feelings, those really difficult feelings? And from a non-judgmental way, you know, that people are doing, our communities and our Indigenous peoples, we're doing the best we can given these experiences from colonization that are very much still ongoing and happening. So I would say that for decolonizing social work, I would say, what does it mean to, you know, look at decolonizing substance use, but also decolonizing, you know, and really looking at it, social work as well as a profession through the lens of colonialism, and how social work as a profession has really been connected to settler colonialism, and that it was, you know, we had Indian agents that came to our communities and then they became social workers. And so I think that's important to make those links for the profession. And, you know, when it comes also down to truth and reconciliation and the calls to action, you know, we have all these reports out too in plain sight that was released about the experiences of racism in healthcare. And I believe that we know this information, and the step is, what does it look like to take action? And I believe that in social work, when we really are trying to be centered in social justice, that we most certainly as a profession have a place to ensure that we're working to create action, and action in a good way. And so that's what I think I can share from that. And I think, you know, for me, I had quite a pivotal moment in my education where one of the articles that we were reading in class was called Am I a Modern Day Missionary? Experiences of a Cree Social Worker, written by Michael Hart. It was done in 1994. And, you know, just even reading over that article before this webinar, you know, so much of that article and that content as an Indigenous social worker, and unpacking just the, like, am I a modern day missionary when, you know, this social work field has been so connected to these pieces of paternalistic and patriarchal ways of practice with Indigenous communities, families, and we can still see that today in policy. And you know, we think of the elimination of birth alerts. That wasn't too far away that those were just eliminated. You know, being a hospital social worker in the last few years, you know, we were practicing with birth alerts. So I think these are very important pieces to know, that this isn't far away from the impacts of these very patriarchal ways of practice that we were having to be held to practice within, and the tension of that, of being a social worker, and just recognizing that what kind of impact that has in the community. And that when we talk about decolonizing, like that's the colonial violence and harm that has been ongoing, and that now, you know, you see the impacts. I mean, you see it in practice when you see the fear of accessing care. well, why is there a fear of accessing care? Well, we just eliminated birth lawyers, but that fear, that lack of safety, all of that is still a part of the experience and in the community. And I think that's so important for us as social workers to know we've been agents and we've actively taken a part in this very colonial, violent policy and harm. And that's just one example. And I know for fellow social workers and colleagues, like I just encourage that we keep on unpacking what that looks like, reflecting and taking action to, what does it mean to repair? What does it mean to allow truth telling and the truth of families and communities? And what does reconciliation mean in our practice too as well? So yeah, I think that's what I'll share with that. And then I'll pass it to you, Cheyenne.
Oh my gosh, I don't even know how to follow. I feel like you've covered everything I wanted to talk about. Yeah, I think just, I think about the fear of accessing care a lot when you're speaking, and like even for myself as a social worker, who we would say, I would imagine like in the way in my profession, I hold some power, I should be confident in my profession. I still have, that fear of accessing services with my own kids, right? And so I think that's really important for us as social workers, is always to, reflect on our profession and how we can do better, but also like really focusing on relationship building. I find like a lot of folks might read all these reports and they really want to jump into action on how to decolonize their spaces and how to, reconcile with our history, but they don't really know how. And I always try and encourage people to build relationships and to have these conversations in safe spaces, and I think that really, it starts there, right? Instead of just trying to do, good, trying to do good, but like not really reflecting on our own positions and where we're at, and like how that creates harm sometimes, right? Like we might be trying to do something in a good way, but not realizing how we're harming other people. So I always encourage people to like make relationships with community and, to bring in elders and have those conversations on how to move forward rather than just jumping into action sometimes. So yeah, I think that's really important. Yeah, I feel like you covered everything I wanted to talk about, so I'm a little thrown off. But yeah.
Thank you both so much. You did cover a lot, and I think in your response, you've already answered some of the other questions that were coming in as well. Before I move on to the next question, though, I just wanted to ask if Olivia or Elder Delhia wanted to add anything at this point.
Oh, I think I'm okay for now.
You good? Okay. All right. So I'd like to move on to one of the other questions that came in. So this is from someone who says, I am a mental health clinician, and I often find that I do not have the social work background necessary to be able to successfully advocate for my clients and their dealings with MCFD. Is there somewhere we can go for additional advocacy for our Indigenous clients if we feel they're not being provided with trauma-informed and culturally safe services in their encounters with MCFD? Maybe Olivia, if you don't mind, we can start with you. You're also not a social worker, you're a birth worker, and I know that you've worked with a number of clients who've had interactions with MCFD. So I'm curious if you could speak to how you've walked alongside social workers in supporting families, and if you have any thoughts here on kind of where you can go for additional advocacy or support if the family feels like they're not being supported fully in their interactions with MCFD.
Yeah, so once again, to reiterate, I am not a social worker, but I would say a majority of my families have had MCFD involvement, and it's been a real learning process and journey to learn how to support them in the best way that I can. And I've really relied a lot on my elders who have experience in social work and family law and like our own ways of doing things. But specifically around the wanting to know where you can go for additional advocacy, that's something that I've struggled with as well, because I'm really not too sure. I don't know. I've had families who have tried to make complaints against social workers that they've been placed with, and often that doesn't feel like there's really any benefit or a positive outcome. If anything, it really seems like often families can be penalized for doing something like that. but the ways that I'm able to provide some trauma-informed and cultural safe support to them is I'm often included on safety plans for families. So as a safe person, especially during the pandemic, families who are in secondary housing or safe housing with the COVID restrictions, they're not really allowed to have very many visitors, if any, which as a new mom, a new parent, that can be really difficult to navigate that alone, especially if you're coming from a place like First Square where you have the amazing support of people like Jeanne and the nurses and the doctors there. The reality between that level of support and then finding yourself isolated in what is the safe situation and the safe place for you that's been decided by someone else can be really, really difficult for people. So I think in the last year, I've ended up providing more postpartum support than actual birth and labor support, just being there in that in-between and that transition period for families. And being able to attend their meetings with them. It makes a huge difference, I think, just to be able to sit beside someone. Often the meetings are arranged like there's social workers and there's supervisors on one side of the table, and then a parent and their newborn child on the other. So really just being able to physically be with someone, can make a big difference. Yeah, but I think in a broader scope of places that exist to provide more advocacy and more support, I'm really not too sure what that is. So I'm curious if Cheyenne or Jeanne or Elder Delhia, if anyone has any ideas around that, I would be very grateful to hear.
I can jump in if that's okay, or if anyone else wants to. So one of my previous positions, I used to actually work with Indigenous moms and families who were pregnant, and then I would follow along their whole journey of pregnancy until they delivered, and then sometimes up to about a year and a half later. And then in my other position, sometimes as an Aboriginal liaison, I would actually see them in the hospital after they delivered. And so, and a lot of Indigenous families during this period come across many different systems that just, they're not made for us, right? And there's the child welfare system is one of them. It's probably, such a harmful and scary one to be interacting with. And so usually when families do come to me and they have that involvement, the first thing I would always do is really rely on their supports that they already have. And I think sometimes we think that we don't have any supports, but we do have a lot, whether it's our aunties or elders, whether it's our best friend, those people that we see every day that are really holding us up in community, and kind of like listing all those out too as your supports. Another one that I always refer people to is actually the BC Child and Youth reps. They have advocates for you, for child and youth, but usually you're in foster care, or it's for the children technically. But if you're a mother and you're in that position, you can still, get an advocate as long as you're framing it, I think, in the way that it's for the child's best interest. So that's another support that I usually connect people to. But also, having anyone there, whether it's your doula, whether it's your birth worker, whether it's your auntie, I think that's a huge step, right? Because no one should ever go to those meetings alone and being like, this room where everyone's, sitting across from you. It's scary. It's traumatizing, So yeah, I don't know if you want to add anything, Jeanne, as well.
Yeah, I think you've covered a lot of what I would say too, both Olivia and Cheyenne. And I think, when it comes to other supports in the community, there's if somebody is eligible, encouraging them to access legal aid, that is their right. And I think that's one of the first pieces is whatever role you're playing, whether you're a mental health clinician, a nurse, or a community support worker, is knowing how to support families and people with what are their rights. And so sometimes that can be, on the unit on FER, we would get Emily's Choice, which is a booklet. I believe it's by Legal Aid, and you can just order those and have those on your unit or in your setting, just sitting out, so that if people need that, there's just some clear clarifications around your rights when you have involvement when it comes to MCFD. So I found that piece just as a resource that you can have. And then the other option is maybe when it comes to practice, I know for maybe you as a mental health clinician, however, you may, what does it look like to advocate within your practice? And so I find, it's encouraging other professionals to be a part of that advocacy role and how you feel comfortable, but like encouraging you to, if that even looks like a support letter that the family can take, where you're really writing from a strengths-based perspective, like Cheyenne said, like many of the families and people in our community have lots of supports and so many strengths that they're already coming with when we're supporting them, which I can imagine with whatever your work has been with the families, that there's always ways to find their strengths, and it can be for us to really honor those and recognize them. Just saying, they're accessing support, they're coming to see me, and writing that in a letter. I've had it. It's not another piece is, even here in the healthcare, I'll have doctors write support notes, nurses will all sign off on it. So those are just some like tangible, practical things that I found that we can send off to MCFD. And also the other piece of being in a part of the MCFD meetings, if you're able to, I find those can be places for you to try to advocate and be a part of supporting the families and ensuring, I think that's one thing is when, whose story is being told and whose isn't, and how we can really ensure that sometimes, if we're there, we can really try to highlight other parts of what the narrative might be, whatever that might be. So I find that a lot in my practice. And then I'm just trying to think what else. I think that, it is, I know a lot of my work in healthcare, in hospital, it's been so much around relationship building with MCFD and delegated Aboriginal agencies. So much of our practice as a hospital social worker, but also as a unit, and also seeing this through the provincial project that I work on, that, relationship building among project stakeholders such as MCFD and delegated Aboriginal agencies, that's such an important piece of our work too as well. So it wouldn't be uncommon that our unit, my experience with FIRST, specifically here at BC Women's, would have monthly meetings with directors of operations from MCFD. And we would come together at the table and say, this is what I'm seeing happening in practice. How can we work together to have a more smooth transition in care? And we're all in this place of really wanting to be coming from a principled practice of trauma and violence informed practice and care, woman-centered, recovery-oriented, harm reduction, so some of these pieces of like, how are we all agree these are important parts of practice, and how do we really meet together to ensure this is really happening for the families when we're working together. So I see that being a really big piece of just relationship building. So if you're finding yourself working with a certain MCFD office or delegated Aboriginal agency quite often, that I really encourage you to reach out to that team, reach out to those directors of operations or team leaders, and say, what does it mean to build relationship? Because so much of our work is about relationship building, whether it's social work or you're a mental health clinician or supporting families. So that would just be another practical thing if you have that option in your role, to just encourage your team or your unit to reach out to have just a conversation. And I think that's always so important in our work, is to ensure that we're working in a good way together, and that although I might be a part of this healthcare system, we're all interacting together to have the same goal of really wanting to support the families to be as successful, whatever their goals may be, to parent, to go to treatment, whatever that may be. We're really coming from this place of supporting the families and their goals, and how do we work together as systems to ensure we're on the same page with that. So those are just some practical things I would offer. And then definitely legal aid if they're able to apply and be eligible. And that's something, you know, on First Square, we have legal aid regularly doing intakes on the unit, even over the phone, and really encouraging families, because sometimes I know when I would meet with families, they would say, well, why do I need a legal aid lawyer? Do I need legal aid? And I would say, you know, MCFD and your social workers actually have a team of lawyers that they're consulting with. So it most certainly is within your right. And, you know, I can understand the fear of, oh no, I need a lawyer. What does that mean? Is this going to be scary? And the fear. And so lots of times it's just letting like information, being informative, giving clear information, and just saying, you know, I offer that to all families who have MCFD involved. It's your right. And if you're, if MCFD has a team of lawyers they're consulting with, it's good for you to have your own, and we can support you with that. I know the legal aid team, we have them come to the unit. So those are just some that's another practical one. So I'll leave it at that.
Okay. Do you want to add?
Oh, yes, very practical. I was just thinking exactly the same thing. The first thing is a lawyer. Have your rights, because we do have rights, you know, as a family. Also, very good safety plan. Help mom, like, let her be the hero of her story. Let mom put together a safety plan. I've done, you know, I've worked with a lot of young women who I just sat with them and I said, who do you have? Who do you have? Name everybody you have that is going to be there for you and how they are going to be there for you. I've got an aunt who can come over on Wednesday night to cook. I have a cousin that comes in and check on me every, you know, like she comes in, you know, on her way home from work, and she'll come in and, you know, check on me. I have support workers who will come in on Mondays, and all these people who will come in and put that, because this is all MCFD is looking for, is safety. Safety is number one. The child is safe. It's put in a safe place. If mom feels like, because there is, you know, I've read that Child and Family Service Act over and over again, and I really have not seen, you know, mom has to stay sober. They have said mom cannot drink with the children around, with the children, you know, while caring for the children. And so if mom has a safety plan where she takes this child and, you know, and she has neighbor down the street, she has an auntie she can call, she has a sister who is constantly coming in and checking on her. You know, that is a safety plan. And this is all MCFD should be worried about, is the safety of the child. And so putting together a really good safety plan, and I really, really appreciate all your comments, especially about the lawyers and then about the support letters. And when you're writing these support letters, think about how mom is going to keep this child safe. I've done a lot of, you know, I've even brought the child, MCFD goes, well, mom is too young, you know, like, you know, she's too young. And I said, okay. So I went to grandma. I said, do you want to be guardian of this child? And she goes, yeah. So we brought her up to the court, and then grandma became guardian of the child. So MCFD no longer had, you know, dealt with mom, but grandma had the child, because maybe grandma was going to be the main caregiver anyway. And so this allowed mom to stay with her mom and bring up her child and bring her up, you know, in the safe way. And once MCFD saw, okay, so grandma is the guardian, grandma, you know, has a full-time job, grandma is she's, you know, she has a secure home, and, you know, there's no issues about grandma. They close the case and they're out of the child's life. So creating that safety plan and helping her be the hero of her story and getting her, like, you know, like we all want the same thing when you think about it. We want the child to be safe, right? We want the child to be safe. We want the child to grow up in a place where they feel loved, you know, they feel part of the community, they can flourish and grow. This is everybody's dream, especially after, you know, hearing about our stories of our children and how they were brought to the residential school and some didn't make it home. You know, when you think about it, MCFD sometimes, you know, we are programmed to think that MCFD has the answer. They don't. MCFD, there are more children in care now that ever went to residential school. It's not a good system. The child does not belong in a government system. The child belongs in a community. The child belongs with their people. You know, like, you know, if you are worried, come alongside us, work with us. Don't say you are wrong, so I'm taking this child. That's, you know, like we want to create a history that our ancestors or our descendants, you know, 7 generations down the road would be proud of us. You know, like, oh, there's, you know, yeah, we had a bad go of it with the Aboriginal people, you know, but look at how they switched things around in 2020, you know, and look at how they, you know, so proud of our people, so proud of our people, of how they work with everyone, you know, and how they work together and know who they are, you know, so yeah, so creating that safety plan for the child, you know, is so important. OCM.
OCM, thank you to all of you. And we also have folks who've been contributing to the conversation in the chat box, offering additional ideas of resources. So somebody names Vancouver Aboriginal Child and Family Services Society, Queltstone in Stalo Territory, First Nations Health Authority, Head Start programs, early childhood educators, community nurses on reserve, and just a few comments here. I've navigated these systems with my adult daughter for her almost 2-year-old son. I think finding someone within your immediate and extended family who can navigate the system, translate interventions, and calm fears, defensive responses is key. Yeah, so having that family member to support goes a long way. And I think that's related to one of the questions that came in. How can we as healthcare providers support engagement and inclusion of the birth givers' existing community and family members in their perinatal journey? Any thoughts, Olivia?
Not currently.
No? Maybe pass it on to Cheyenne, then Jeanne, then Elder Delhia.
Maybe we could pass it on to Jeanne. I think I need some coffee.
So, you know, just when it comes to any support, you know, how to support bringing family, community when it comes to the healthcare setting, you know, from my experience, I find, as it's been shared with Elder Delhia and Miranda too, about having ceremony and, you know, having that even be in the healthcare setting. So I know that's something that, from my experience working on First Squared, you know, just going back to that, we have Welcome to the World ceremonies on the unit with Elder Roberta Price and Elder Glyda Morgan. And I can say that, you know, that's prior to COVID, you know, that's a ceremony for the family. That's a way just to welcome the family and who their support people, whoever it is in their time to honor them in their journey on the unit. But I find that, you know, especially when it comes to the field of perinatal substance use, and I know in our project just highlighting the importance of really looking at the support for really supporting, not just baby, but mom, baby, mother baby togetherness. If we're really coming from that lens of ensuring we're keeping that connection and supporting that connection, that we're also going to support that connection for mom and their connections to their families and their communities. So I think that's something that we could be doing more of in healthcare, that sometimes even when it comes to discharge teaching, involving the family and the people that'll be there to support the parents, and really looking at it through a lens of family. And I was just thinking of somebody in our community, member that was sharing about their work from an Indigenous community partner that is funded through the project, doing wonderful work in Seabird Island. And I just remember them sharing about when they're working with the women in pregnancy, that sometimes they're also talking to grandmothers and their mothers about teachings around working and supporting baby. And I just think of that impact of, those teaching and involving family, even in that process of, how to console baby and things like that, that, I think of the impacts of residential school and how that's in generationally impact our mothers and our fathers and our grandparents, our grandfathers and our grandmothers, and really welcoming them into that space about, really having this healing opportunity together. So that's something I've just wanted to share from the project work, and really witnessing just some amazing, beautiful work of generational healing as a, community birth support worker, just in their practice of seeing how important it is to engage the whole family and some of the baby teachings from a health perspective. And so, yeah, I think I'll leave it at that if anyone else wants to share.
Just kind of adding on to what Jeanne said, it's so beautiful to see our practices being reclaimed, especially when they can be incorporated into the hospital room, into birthing spaces that are not our own homes. It's just like, it's so beautiful to be a part of, and definitely having the openness of the staff and the people who work at the hospital to be willing to allow those ceremonies and really hold space for that to take place is really important. And I think it's just such a beautiful opportunity to heal and to start off in a really good way.
Thank you. Anything to add?
Oh, sure. It's also important on how Native people have been treated in the health services in general. I've asked a few people, and a lot of like, how do you feel about being, how would you like to be treated, and this is always a question. A lot of people just say, just don't ask weird questions, like some people will say, well, wow, you're so pretty for a Native person. It's like, really? or are you mixed? Like, what is your mix? Or you're not full Native, are you? Or you're just really smart for a Native person, or all of these I don't know where a lot of these questions come from, but just be very careful, with the questions, when you're talking, especially for a young mother who comes in very afraid she might lose her child. Also, that, with postnatal, you never know what's going to happen with that depression and stuff like that. So, there's a lot of anxiety. Just be very gentle, very careful with mom, and because everything that she feels goes into the baby, like the baby is feeling it too. And, that's one thing we said is, you keep the mom calm, keep her calm, because baby will feel it and the baby will become colicky, you know, very colicky, and you know, so which will make her life even harder. And so be just very gentle and kind with your birds, and you know, and a lot of times, you know, they're mandated to go to counseling. You can never get this, you know, like they're mandated to go to counseling. You know, like, you know, counseling should be something that is brought as a gift, and you know, when it should be, you know, presented as a gift rather than mandated, because a lot of times they're, you know, they have to retell their story to a complete stranger every time, you know, like, you know, like, and you know, and a lot of, you know, a lot of times people just don't want to talk about their story over and over again. I don't. You know, like, you know, just, you know, that's in the past. We're moving forward here. You know, how do we, you know, you know, keep in mind, you know, these that, you know, our people are very, very shy and very sensitive, and it's, you know, and I've been as guilty as the next person about, you know, because my personality is quite, you know, can be very outgoing, you know, which sometimes I have to really, you know, like bring it back, let her feel everything that she needs to feel. You know, this, you know, there's nothing I can fix. You know, if I could change the next person or fix the next person, I could make an apple grow on that tree. I am not God. I am not. And, you know, we're there to hear. And if they want to share the story, they're more than welcome. And be honored with the story. I just want to also say I'm just so honored to be here with all the panelists here. You know, I'm just so impressed with the knowledge and the heart and the grace, and you know, it's just you know, just agreeing, you know, nodding. I'm not sure if you saw me nodding and holding my hands up, but just agreeing and nodding with you all, and I'm just so proud of each and every one of you, and just really keep going. We just encourage each and every one of you to go on with your practices, and you know, remember who you are, and you know, all these laws and all these crazy, you know, remember our way. What is our way? That is our law. You know, whatever you feel compelled to do with your rights. You know, the duty, you feel, you know, duty, you're duty bound to do this, you're duty bound to do that. This is our law. You know, this is what our ancestors have passed down to you. You know, and so you know, these laws that are put, you know, they may suit us. You know, we're all human beings. Or they may suit us in some ways, but just remember yours. Just remember who you are and what is your way. And it may not come right away. It may not come until you're an elder, but it will. You know, but just you know, pray to your elders, or pray to your ancestors, or your you know, your spiritual beliefs, and do ceremony, and you know, be part of that, and you know, and it'll come to you, whoever you know, however it is. And just want to really encourage you all. This is really good what you guys are doing, and really proud to be part of it. OCM.
Miranda,
OCM, thank you.
I just wanted to know if I can close before everybody goes. As Elder Delhia is speaking, remember I talked about how when like the ancestors are taking over and I got that thing in my stomach and something's going to come up. I would like to sing a little bit of the Strong Woman song at the end for all of you and all the work and everybody online. It's coming. So I'll let you finish up in closing, and I just wanted to say that I'm being compelled to sing, and I don't usually do that, but I'm starting to get wiggly in my chair, so it's gonna come soon. So the ancestors are speaking, and it was your daughter that taught me that. When it comes up in my throat and I'm trying to like not use it and you can't control it, that's what's coming.
Yes, thank you. We'd love for you to close off that way, Nicole. I just want to thank everyone who's joined in. It's been a very active chat, and I apologize if we weren't able to get to your question. Thank you so much to all of the panelists to join, and maybe we can just do a real quick circle around and you can share just if you have a final thought or a final key message that you wanted to pass on to everyone who's joined us today. So we'll go to Cheyenne, Jeanne, Olivia, and then back to you, Elder Delhia and Nicole.
Final thought. I think what's really resonating with me is what Elder Delhia said about letting her be the hero. I think that's really sitting well with me. And yeah, I just think that, you know, when we're working with Indigenous families and moms, I feel like we really have to show empathy, and part of empathy is believing folks and the story that they're telling and holding space for safety. And so yeah, so I really like that. I'm gonna carry that with me, letting her be the hero. So thank you.
Thanks, Cheyenne. So I think for me, I just wanted to close out and say it's such an honor and a privilege to be in this circle. And I just really appreciate all the questions. And, you know, I think this is also such an ongoing conversation that's needed in this field specifically. And I did share in the chat, just if you're interested in any more information on the Provincial Perinatal Substance Use Project, we have so many amazing resources that are coming out. We have an Elders Toolkit. I know just one of the last questions was around how to support Indigenous families on the unit and healthcare settings. And so Elder Delhia was a part of our Elders Toolkit, where we had 12 elders throughout the province of BC share through dialogues about, you know, what healthcare providers need to know about involving elders in care. And so that's just one example. I you know, believe our project is really trying to further this dialogue when it comes to perinatal substance use and working in a good way. So I included that link if you're interested for more of our resources that we have out, and more to come. We have a blueprint coming out as well, which is an amazing resource too. But overall, I'm just so honored and so thankful for this circle, and just excited for the work to keep on coming, and also holding my hands to you know, our elders, Elder Delhia, for being here in this circle with us, and just my fellow Indigenous sisters and aunties being here. It's just so wonderful. So thank you.
Thank you all. I just feel so like inspired and hopeful. It's so beautiful to be able to sit in circle with everyone here and share our knowledge and thoughts and wisdom and spirit. And yeah, I'm just so excited for the work moving forward, and the fact that we're having this conversation all together. And thank you everyone who joined us. It really means a lot.
Yeah, thank you so much, everyone. I'll say what stood out for me is when Jeanne was saying to start with yourself and be mindful of what you're bringing into the room with you. That really resonated with me. So thank you for those words of wisdom, Jeanne. Over to you, Elder Delhia and Nicole, to close us off.
I just, I think what I said, you know, I'm just so honored to be part of this program. I'm just so honored to meet each and every one of you and hear about the work that you were doing in this very important, you know, important, we are moving forward. We are moving forward. This is the road forward, you know, that we are letting her be the hero of her story. We are putting safety first. We are walking with her. We're and this is what I'm hearing, you know, hearing, and we're all just doing our little part. Just remember that we're all just doing our little part in this, you know. And she's got to learn to be the hero of her story. You know, this is, you know, like in a feasting system, we all put. You know, back in the day, we would put all our meat, we would put all the, you know, gifts in one pot. You know, this is what we're doing. We are putting into the pot. We're putting in the mom, and we're putting that in there. We are not the hero of this story. Try not to be. You can be, but let her be the hero of that story. Because she's got a long way to go. We're just at the beginning. She's got 18 years and more, 25, me 40, supporting and bringing up this child. And so she's got to build strength. You got to build her up and, and give her fuel for her engine, pray, teach her how to pray for fuel for her engine. And it is scary to ask for help because, as Aboriginal people, if we ask for help, it's taken away from us, so if she asks for help, her child is taken, and that's it's a scary place, and it's, full of panic and fear. I grew up in panic and fear, that my child, for some, never had a reason to, but, and we do silly things as Aboriginal people. We'd stock our cupboard and never really eat the food, because the ministry worker can come in and take a look, in your cupboard and say, okay, you've got food, but we never ate the food because, because it was, so, and I'm still to this day, my cupboards are stocked, and my husband's like, maybe we should start throwing away some of those cans, but it's just that, it's just part of, it's just part of, the trauma that we've been through, as Aboriginal people. It's okay, to eat those cans of food. It's okay to use that flour up. There's more to come, and that's, just remember, you're just a small part of it. You're just putting into you're just putting into the common goal. You're putting your part. This is your gift, and and she's the one that's got to take it and go, right? Lucia.
Thank you all. This is a dream. This is a dream to have this webinar, and so grateful to be on an amazing team. I started out on the perinatal substance use project a year ago, and to finally come around a full year now and just see these beautiful webinars coming to light and sharing our truth, sharing our gifts, sharing our clan, sharing our teaching, sharing our matriarchs. These are all gifts, and it's time for us to shine. And so I just want to honor all our ancestors and everybody online. We all have ancestors. We all actually come from clans. We don't have time for that talk today, but every single person came from a clan. Every single person came from a clan, because you wouldn't be here if your ancestors did it. And I am all about clan work and being of service and being of duty. And so I hear my spirit is calling me to be of service right now, to sing the Strong Woman song for all the birthers we're talking about, past, present, and future, and for all the people who are providing service and care and love and support and families. Now my voice is shaking. See, that's why I was saying it was coming up. And so the Strong Woman song was composed in a women's penitentiary with Indigenous women. And we might not be in a physical penitentiary, but it feels like it as women, as we navigate the space and all these different experiences we encounter as aunties, as grandmothers and mothers and sisters. And so I would like to sing a little bit of that song in closing, and just Snachalia for you all joining us today and taking that journey. And when the recording is up and ready, it'll be posted on our Aboriginal Healthy CH YouTube channel. And when that's available for all those who have registered, which is everybody online, you'll be sent the link afterwards. I think I'm going to stand, so you can sit in front of the camera. I'll do that. I don't want to. I'll just stand and just sing. Natalia. We're done.
That was fun. One more.